I'm Lynn Goldstein, a registered dietitian. Understanding cholesterol can be tricky. You've probably heard a lot about it, and so you may think cholesterol is always bad for you. But the truth is, cholesterol plays an essential role in keeping us healthy. Cholesterol is a soft, waxy substance that's found in every one of our cells. Our bodies use it for many things, like forming cell membranes, producing vitamin D and other hormones, and even making bile acids that help us digest certain foods. Cholesterol travels around the body through the vascular system. But blood is watery and cholesterol is fatty, and just like oil and water, they don't mix well. So to circulate in the bloodstream properly, cholesterol is carried in small bundles called lipoproteins that are made of fat, also called lipids, on the inside and proteins on the outside. There are different kinds of lipoproteins that can carry cholesterol. Low-density lipoprotein, or LDL cholesterol, is the bad kind of cholesterol. It carries most of the cholesterol in the blood and delivers it through the body. High levels of LDL can lead to cholesterol deposits in vascular walls, creating plaques that sometimes narrow or even totally block blood vessels. That's called atherosclerosis, or hardening of the arteries. And it's why this kind of cholesterol is bad. The higher the LDL level, the greater your chance of having a heart attack, stroke, or developing several serious conditions. High-density lipoprotein, or HDL cholesterol, is the good kind of cholesterol. HDL helps clear cholesterol, carrying it back to your liver, where the liver removes it from the body. That's really good. Having high HDL levels usually protect you from developing cardiovascular disease. And this is where the plot thickens. Some people can have high HDL levels and still be at risk for heart disease because the HDL is dysfunctional. It doesn't work right. The cholesterol in our bloodstream comes from two sources. About 75% is produced by our own liver, and about 25% comes from foods we eat that are from animals. Actually, our bodies naturally produce all the cholesterol we need for normal functioning. But sometimes, genetics can cause us to produce too much of the bad kind, or too little of the good kind, or the kind that just doesn't work properly. In addition to any inherited predisposition, other factors that can influence our cholesterol production that we cannot change are age and gender. There is a shift toward worse cholesterol numbers as we get older. As a registered dietitian, here's what I tell my patients. Stop smoking, lose weight, even a little can make a big difference. And exercise, just 30 minutes a day of moderate activity can help. Eat a diet full of fruits, vegetables, whole grains, and high-fiber foods like oatmeal, and certain fish, or other foods that contain heart-healthy omega-3 fatty acids. Steer clear of saturated fats like those found in red meats, full-fat dairy products, and trans fats that are in some store-bought baked goods. There are also medicines, such as statins, that can help you reach your recommended cholesterol levels. It's important to regularly have your doctor do a simple blood test to see what's up. Having cholesterol levels in check is essential for good health at any age.